6 Early Indicators of Dementia that Demand Your Attention. Hello and welcome. Today we're going to talk about a condition that affects millions of families but is often misunderstood: dementia. More than 55 million people around the world live with it, making it one of the leading causes of disability and dependence in older adults. Most people think dementia starts suddenly in old age. In reality, it can develop years, sometimes decades, before the obvious memory loss appears. That's why recognizing the early signs is so important. The earlier they're noticed, the sooner steps can be taken to slow progression and protect long-term brain health. So let's walk through 6 early indicators of dementia that often fly under the radar. Before we begin, if you care about keeping your brain strong as you age, make sure you're subscribed and have notifications turned on. This is where we share the truth about brain health that isn't always talked about. And one quick request: if this topic speaks to you, type 1 in the comments. If not, type 0. Your input helps shape future videos and might help someone else going through the same journey. 1. Subtle changes in posture and movement. Dementia doesn't just affect memory, it also influences how we move. The brain plays a key role in balance and coordination. When cognitive function begins to decline, the body may reflect it. Look for shorter strides, dragging feet instead of lifting them, or a slight shuffle. Balance problems may lead to tripping, even in familiar spaces. Everyday tasks, like using utensils, pouring water, or holding a cup, may become unexpectedly difficult. You might also notice a stooped posture or leaning to one side. At first, these changes may look like normal aging. But when combined with other symptoms, they can be an early neurological signal. 2. Sensory changes. The senses don't just help us experience the world, they feed constant information to the brain. Dementia disrupts how this information is processed. Depth perception may weaken, making stairs or pouring liquids tricky. Some people misjudge distances, leading to more bumps and stumbles. Smell is another early warning sign. A declining sense of smell long before memory loss has been linked to Alzheimer's disease. Hearing loss or sensitivity to sound can also play a role. Research shows that untreated hearing loss in middle age nearly triples the risk of dementia. Why? Because the brain works overtime to process unclear sounds, creating mental fatigue that speeds up cognitive decline. 3. Muscle weakness. It might surprise you, but grip strength is strongly linked to brain health. Studies show that older adults with weaker grip strength face a higher risk of dementia. Struggling to open jars, carry groceries, or firmly hold objects isn't just a physical issue, it may signal underlying neurological changes. Muscle weakness often leads to reduced physical activity. Less activity means less blood flow and stimulation for the brain, which accelerates decline. That's why strength training, even simple exercises like resistance bands or light weights, is one of the best protective habits for your brain. 4. Sleep disturbances. Sleep problems are one of the most overlooked early signs. Trouble falling asleep, waking up frequently, or feeling exhausted during the day could be red flags. Some people develop REM sleep behavior disorder, where they kick, punch, or talk in their sleep. Others experience intense nightmares or vivid dreams that feel unusually real. Poor sleep has a direct impact on the brain. During deep sleep, the brain flushes out toxic proteins, including beta amyloid, which is strongly linked to Alzheimer's disease. Without quality rest, these proteins accumulate, speeding up damage. If sleep issues are new or worsening, don't ignore them, they could be one of the earliest neurological warnings. 5. Emotional withdrawal and apathy. Another subtle but powerful indicator is emotional change. Dementia can make people feel indifferent, detached, or less interested in activities they once enjoyed. Unlike depression, which comes and goes, apathy in dementia is steady and persistent. Someone may stop attending social events, show little reaction to emotional situations, or avoid conversations they used to enjoy. Family gatherings often highlight these shifts. A once lively person may now sit quietly, detached, almost as if the world is happening around them rather than with them. This withdrawal can deeply affect relationships and should never be dismissed as just getting older. 6. Language and word finding problems. Struggling with words known as aphasia often appears years before a formal dementia diagnosis. It might look like forgetting everyday words, calling a jacket a shirt, or constantly pausing mid-sentence to search for the right term. Some people repeat the same word or phrase without realizing it. Names, even of close family members, may slip away. Over time, communication becomes frustrating for both the individual and their loved ones. If language difficulties appear alongside the other signs we've discussed, it's a strong indicator that professional evaluation is needed. What to do if you notice these signs? If you or someone close to you shows several of these early indicators, don't wait. See a healthcare professional. Many conditions mimic dementia, including vitamin deficiencies, thyroid problems, or even stress. Catching it early allows doctors to rule out other causes and, if dementia is the issue, start treatment options designed to slow progression. Protecting your brain health. While there's no cure yet, lifestyle choices make a big difference. Research shows you can lower your risk and improve quality of life with a few proven strategies. Challenge your brain. Learn new skills, play strategy games, read, or practice a second language. Move your body. Regular aerobic and strength exercises increase blood flow and neuroplasticity. Eat for your brain. Diets like the Mediterranean and MIND diets, rich in leafy greens, berries, nuts, and olive oil, are strongly protective. Manage health conditions. Keep diabetes, blood pressure, and cholesterol under control. Prioritize sleep. Aim for 7-9 hours of quality rest every night. Cut harmful habits. Quit smoking and limit alcohol, both of which accelerate brain aging. Hope on the horizon. New treatments like lecanemab and donanemab, antibody-based drugs designed to clear beta-amyloid plaques, show real promise in slowing cognitive decline. They're not cures, but they represent major progress in dementia research. Ongoing studies into gene therapy, brain stimulation, and lifestyle-based prevention strategies give hope that the future of dementia care will be brighter. Final thoughts. Dementia is complex, but early detection is powerful. Subtle changes in movement, senses, muscle strength, sleep, emotions, and language may feel small at first, but together, they paint a picture worth paying attention to. If you notice these signs, take action. Don't dismiss them as just part of aging. Thank you for spending time with me today. If this video was helpful, type 1 in the comments. If not, type 0. Your feedback truly matters. And before you go, make sure you're subscribed so you don't miss upcoming videos on brain health, aging, and science-backed strategies to stay sharp. Stay proactive, stay hopeful, and take care of your brain. It's the best investment you can make for your future.